it's a very special event, but also importantly, because we are actually celebrating the 15 years since the report To Err Is Human was released. So it's a very key meeting for us in terms of looking back, looking where we are, and certainly a lot of looking forward. And I think all of us will agree there's a long way to go. Now, I just want to make sure that first I recognize the Rosenthal family, although they haven't quite arrived yet. And actually, through the years, this symposium has taken on some really important topics. And the Rosenthal family, which I recognize, but they're not here, but I'll mention that Nancy Stevens Rosenthal and her two children, Jane and Mick, joined us last night for dinner and will be joining us today this morning. Now, many of the lectures that we've taken on are really important topical issues. But if I look back on, since it was started in 1988, we've done 9 past symposia on issue of patient quality. So that goes to show how important this topic is, and this will be the 10th. And importantly, I would say that this particular topic today, as I said last night, defines an organization. There are some things that sometimes happen that define organizations. Certainly for IOM and the National Academy of Medicine, it was a defining series of activities when we took on the quality issue to the leadership of Ken Shine and others, and he's going to tell you more about this. Certainly it was his foresight and the IOM leadership, the council, and others who really connected all these together, launched this very important initiative, with the first one, of course, To Err Is Human. So we are very happy that we hear more about this in the first session today, about, in fact, that whole initiative, how it got started, how do we get here, and it's going to be very exciting. So I just want to begin by saying that this is what the symposium in the past I mentioned, and I think the foundation documents to me, the reports are these two: 1999, To Err Is Human, and 2001, Crossing the Equality Chasm. And I would say that what was, as Ken would tell you the story behind it, is what really caught the public eye, and really, to that matter, the entire community in health care, as well as, in fact, I think overall communities, is in fact the exposure, if you will, of the medical errors piece. An aspect, of course, of quality, only one. But in fact, this one says we need to build a safer health system. Medical errors can be defined as failure of a planned action to be completed as intended, or the use of a wrong plan to achieve that aim. Now, Ken would tell you the group tried to figure out, based on what available data, how much harm was being done through these errors, and came up with a number 44 to 98,000, and of course, press says 100,000. We know this number is grossly underestimated. I say grossly because subsequent studies more recently shown 400,000. Now, if we started 900,000 15 years ago, we're now at 400. We're moving backwards. But the truth is, of course, you can imagine healthcare is getting bigger. The number of people exposed to new technology are higher. It's more complex. And therefore, the numbers, I think, based on 15 years ago, the number, of course, is the guesstimate of the data they had. And I think we're still trying to figure out exactly what it is, but the number is huge. And you can see the cost of errors is huge in the United States, billions of dollars. And the majority of errors, as pointed out by so many of you leaders, are by faulty systems, processes, conditions that lead to people make mistakes or fail to prevent them. I also feel, as you know, I ran the Duke Health system. We had some significant error. It's a cultural issue too. At the end of the day, culture trumps everything. And all these processes can help, but you have to have the right culture. Now, as you know, the Crossing Quality Chasm, a new health system for the 21st century, described really 6 aims: safe, effective, patient-centered, timely, efficient, and equitable, and 10 rules for care delivery redesign. And of course, I won't go through all of them, and of course, many of you experts know this really, really well. I just want to point out that the original committee, and many people are here, and we'll have the chance to recognize them. Suffice to say that Bill Richardson, who's really here in the first row, was the chair, and you can see Don Berwick, Lucian Leap, so many others that you forgive me if I don't read it, except that, in fact, the slide captures the very exciting, in fact, at the time, and still people who continue to lead in this area, like Mary Wakefield, who's the Deputy Director of HHS, and others. We recognize Janet Corrigan, and as I said, forgive me if I don't read the entire list. You recognize them. Now, the question is, what happens? And I think what was really exciting about this is that this became not only a single one-time thing, it is in fact a continuous involvement of the National Academy of Medicine, or IOM, in this whole area. And it became a quality series. And since the original one, we put out 9 others, in fact 10. The 10th one, of course, just last month, about diagnostic errors. And if you look at the range of topics that is being addressed, it ranges from health professions education, see in the upper right corner, to healthcare in rural America, to improving healthcare quality for mental health, substance abuse systems, and on and on. I think building on the foundation and the idea of what we need to do, because IOM found out to look at all the various relevant issues. And I think these reports have been transformational, certainly in our country. I know that because, as I said, I lived the past 10 years as a health system CEO, and I can tell you how transformative it is in the way we conduct patient care every single day. Now, many people ask frequently the question, IOM puts a lot of report out. What is the impact? Well, I can show you, I'm going to show you, in fact, what's happened. The journey is only beginning, still, even 15 years, long way to go, but I think we've come also a long way, despite description of the beginning. So, in 1999, shortly after release of our report, the impetus for system-wide improvement in patient care and quality, President Clinton signed the Senate Bill 580, the Healthcare Research Quality Act of 1999, which renamed the Agency for Healthcare Policy and Research to the Agency of Healthcare Research and Quality to indicate a change in the focus. And of course, we all know AHRQ as we know it today. This slide shows you, just in a summary and probably not comprehensive enough, all the things that we can see that's happened over the last number of years, result of this, starting with the report and AHRQ, as you see, and JCAHO National Patient Safety Goals. And I see Don Warwick here, the IHI Improvement of 100,000 Lives campaign in 2004, which in 18 months, they claim to have prevented an estimated 122,000 lives in that period, engaging 3,000 hospitals. IHI then also launched the 5 Million Lives campaign in 2006 to protect patients from 5 million incidents of medical harm over the next 2 years. So thank you, Don. That's great leadership. And I say many hospitals, and you can see also team steps, which we play, certainly at Duke, we're very much involved with it, and so many others that I would say that many of you are involved with all these to recognize what a great impact this series report has done. From a healthcare delivery system, computer physician entry orders, pharmacists rounding with teams, standardized protocols, team training have yielded really important results. And as past CEO, we used to make rounds every week with different wards just to talk to the providers and patients about what their concerns are, and really creating ultimately a culture of patient quality and safety with all the things that's being these initiatives that push us forward. Very, very exciting. Now, if you look at the Affordable Care Act, and of course many of you have footprints all over the place, and Don played certainly a great role as CMS director, a lot of provisions around quality and safety. National Quality Strategy, Center for Quality Improvement in Patient Safety, Patient-Centered Outcomes Research, Center for Medicare and Medicaid Innovation, Mandatory Physician Quality Reporting Program, public reporting on the quality of health insurance plans, additional reporting patient data related to race, ethnicity, sex, and language, and authorized numerous payment and delivery models. So we always ask, well, how do you measure the success? Well, one thing that you can see, in fact, is the data that came from ARC just on Medicare alone, with actually focusing on hospital-acquired conditions and many other measurements. ARC and HHS, Secretary Burwell, reported at the end of last year, in fact, the significant finding out of the HHS. As you can see, the numbers, which I'll read to you, is a 17% reduction in hospital-acquired condition from 2010 to 2013, 1.3 million fewer patient harms, 50,000 lives saved, and $12 billion in health spending avoided. Now, so we can all celebrate, right? Now, Ken was careful to say this is not a celebration alone, but in fact, the journey is just beginning. I was just blown away by this paper last month from Partners Healthcare. David Bates, and this is the MGH data, the #1 hospital ranked by U.S. News & Report. And that they found from anesthesia, perioperative medicine, that medical errors still occur in nearly half of all surgical procedures, and 1/3 of all those errors result in adverse drug events, harm to patients. So we recognize that, of course, while we celebrate and say we're making a long way, we need to understand that healthcare is dynamic, it's constantly changing. Technology is changing. Systems are changing. So it's not only the fact we can say we know what to do today, we're going to have to stay ahead of what's happening and being able to get ready for all the changes. Now, I just want to end by pointing out to you at IOM, we are committed, and NAM, we're committed to this. Our commitment is strong, and we continue this quality because as long as we hear quality of patient care is so central to what we do and to the health of our nation and globally. So, a couple of months ago, we released our latest report on the series on improving diagnosis in healthcare. Now, I won't have time to go over this, and won't have a lot of time on the program itself, except I believe that maybe as you come back from lunch, we're going to show you a patient video, but we're using, as we learned from the initial report, the toolkits to disseminate this, to get patients engaged, because the failure to establish an accurate and timely explanation the patient's problem or communicate that explanation to the patient is a problem. And in fact, if you look at the foundation of all we do in patient management, we start with diagnosis. And you'll be amazed how frequently, in one way or the other, we can count diagnostic errors. Just think about this. Hard to get number, but I think that as the committee work really hard, they're able to make the statement that it's likely that most of us will experience at least one diagnostic error in our lifetime. I certainly have experienced this. Not always with devastating consequences, but sometimes. But the fact that it happens is a wake-up call to all of us. We've been focused so much on medical errors, surgical errors, medication errors. It's time to focus on diagnostic errors. And the amount of redundancy and the saving cost is astounding. And this is, in fact, the big push that we're having. The other big area that we are focusing on, and Don and I share this passion, is that quality issues, which this country now, I think if you're in healthcare, is kind of, it's part of what we think about all the time. But in many other countries, as the world is pushing for universal health coverage, about towards 2015, and Don and I to many ministerial meetings talking about this, the question is you can have access to care, but if the quality is not good, that would be horrific. And the data coming out from GI and others, Harvard School of Public Health and others, shown as much as 40% errors, in some low, middle income countries. So it should be embedded into UHC as a fundamental principle of what we need to accomplish. So I just want to end by saying we have actually learned that it's not only talking to ourselves, but talking to really people matters, and of course, patients and their families matter. So in fact, this just shows a video of a patient who expressed his experience in diagnostic error, and we have 2 kids and others, which we are now trying to disseminate this very important issue and hope there's a whole momentum going behind this in some system improvement in diagnosis, right? The communication, the decision, all of you have experience between different parts of the organization in imaging, in blood tests, and the whole bit. But nevertheless, I think a whole system together is a critical, important issue. I want to end by thanking the Rosenthal Symposium Planning Committee for putting this wonderful program together. By the way, there's 600 people joining us on webcasts. So I'm told that, in fact, many of you are watching this, and it's really lively, and so many of you are here today. So thank you very much, and let me therefore welcome all of you. Thank you. So with that, I would like to introduce our keynote speaker, a good friend from Duke University, Dan Ariely. I've known Dan for a while, and he is certainly a great innovative thinker. He's a James B. Duke Professor of Psychology and Behavioral Economics at Duke University. Actually, I hold the same distinction of the same chair in medicine at Duke still. He has a doctorate degree in cognitive psychology from UNC, Chapel Hill, and a second doctorate in business administration from Duke University. His work questions the forces that influence human behavior and the irrational ways in which we often all behave. He's a founder of the member of the Center for Advanced Hindsight, co-creator of the film documentary Dishonesty, The Truth About Lies, and a 3-time New York Times best-selling author. His books include Predictably Irrational, Upside of Irrationality. Gee, Dan, I'm a little worried about us. And The Honest Truth About Dishonesty and Irrationally Yours. He's also a bi-weekly advice column, writes one for the Wall Street Journal called Ask Ariely. And in 2013, Bloomberg recognized Dan as one of the top 50 most influential thinkers. So you can see that the planning committee and Ken thinks out of the box and say, we need people from outside the field to come in and tell us more. Later you hear from Peter Pronovost and others how, in fact, we can actually get much more thinking and learning from people from outside and technology to help us advance our cause. So Dan, welcome. Come on up.
Thank you.